Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Rupa KG. She has done her MBBS, MD, and then she has done DNB in neurology. She has had a brilliant academic career, and even now she is so much concerned about the people and the society. She has written a wonderful book, Decoding Headache in Women, and that is a very good guide for not only for the women, it is even for the doctors, it is a good guide. And apart from that, she has worked and treated the strokes, epilepsy, dementia, a variety of patients. And more important is she has focused on headache, prevention of headache. And today, let us listen from the horse's mouth, that is Rupa. What is this headache in women? Is it different from men? What is it? Please tell us, Rupa.
Yeah, thank you so much for giving me an opportunity to talk about a headache. So headache is everyone's business. It is not just in women. It can have in pediatric patients. It can have in elderly patients. It can have in
Correct.
many, even in men. So, but there are certain
But
observations what we
there
have
are
found.
there are some people like me, they have never had headache in their life, and that is because we don't have head at all. Okay,
No,
go
no, no.
ahead.
That headache is very quite common. Globally, if we see 15 to 25% of the cases, it is the commonest headache is the symptoms. And there are so many factors which can contribute to headache. But when it comes to women, if I had to only restrict myself to the women, it is entirely a different, different arena, different field, where we have to give a special attentions depending on the different stages in a women. For example, from the puberty, during the adulthood, during the pregnancy, lactations, and postmenopausal period. There are so many factors which can contribute. In the puberty, if we see, so when they attain the menarche, that's where the entire difference starts. The women starts having more frequent headache, and migraine is more common among that. Migraine and tension type of headache are more common in women. So it is in
Okay.
women, migraine is 3:1. That is three times
Okay.
more common in women than in men.
Than the
So
men.
menarche,
Okay.
the entire difference starts during the menarche. So
Hmm.
during the menarche, due to the hormonal changes, the estrogen
Hmm.
fluctuations, actually, it is not the estrogen level, it is the
Hmm.
fluctuations which contributes to the headache frequency and chronicity in a women after menarche. So that
Hmm.
is why their headache story starts from there.
Hmm.
Apart from that, there are a lot many psychological factors which also contributes during the young in young girls. We see a lot of psychological factors which also contribute, psychosocial factors, cultural factors, which can contribute to the headache and its
Hmm.
chronicity. So accordingly, we have to recognize and we have to treat. Then next stage comes, that is the adulthood, because they have a equal challenges, not just looking after the household, they have to look after the their workplace also. So screen time, everything contributes to that, and both the contributions is increasing the frequency prevalence of headache in a women. So
Okay.
then comes what is that during the pregnancy. During the
Hmm.
pregnancy, it's entirely a different challenge. We know there are
Hmm.
so many physiological factors which takes part. There will be
Hmm.
hypercoagulable states. The patients will have a lot of endothelial dysfunctions, physiological changes during pregnancy, which can contribute to the clot formations, which can contribute to the CVT or the stroke risk, or so many other factors which also
And
has
at
a
the same time, you have to give the drugs which are safe to the baby also,
correct,
because the
correct,
fetus will be damaged if you take, if they indiscriminately take the tablet on their own, So there is the
correct.
point that they have to come to you and then get evaluated. That's also
Correct.
important. Yes.
Correct. So in special pregnancy, we have very limited medications. Any
Hmm.
pregnancy with a simple, when we know this is a migraine, when we have ruled out with an MRI that it is not a secondary headache, there also it is an entirely different challenge, because any medications what we use for the adults, we can't give it to the pregnancy. We have to restrict
Yes.
ourselves to acetaminophen,
Correct.
and we have to give them the lifestyle modifications like
Yes.
good sleep, avoiding screen time, and regular food habits, having focusing on their diet, nutrition. There are certain things. Diet also plays an important role. Junk
Hmm.
foods can trigger the headaches. Actually, that is
Yes.
what.
Very,
So
very
young.
important. Very important. High
So
carbohydrate, high sugar diet, and they can also trigger the headache. Yes.
headaches. That is why we have to give them all that, the diet, then nutrition, so regular food habit, regular sleep, apart from acetaminophen, what we give. So at the most, if they have a severe acute headache, then we can give this metoclopramide, as I said, the parenteral metoclopramide to control the acute headaches. So the same thing when it has to preventive factors. The pregnancy itself is prevention during the second and third trimester. That is God's gift.
Okay.
You know,
Okay.
because by second and third trimester, their migraine headache frequency comes
They'll
down.
come down,
But
come down.
comes down. But if in case if there is a new onset headache with increased severity, with increased vomiting, if there is a tendency of seizures and
And
neurological deficits,
they may have a high blood pressure during that
high
time.
blood
And
pressure,
that, yeah,
yeah,
that also has to
yeah,
be kept
blood
in mind.
pressure. So the preeclampsia, eclampsias, and CVTs, all these factors, stroke risks, all these factors should be kept in mind when we are dealing with a headache, new onset headache during pregnancy. Unless
Pregnancy.
proved otherwise, we have to treat it as a secondary headaches, and we have to do an extensive workup, including the MRI brain, blood tests, and then EEG. So
Okay.
accordingly, depending on the
But
cause,
you
we have to
said
take a treatment.
MRI. That means you are going to avoid CT scan because
Yes.
the any X-rays or that can damage the baby. So that has to be avoided. Yes.
Yes, and even certain medications also need to be avoided. See, sodium valproate and all, there are certain teratogenic medications which should not be avoided in a pregnancies. That is
Yeah,
why
they can
choosing an
damage the fetus. Yeah, very important.
fetus
Yes.
feet. That is why choosing an anti-migraine medication during pregnancy is a different challenge for us. So there are very limited medications available. So that is why we focus more on the abortive aspects of acute migraine so that it should not go for a chronicities. And if
Okay.
even if there is a chronicity, we have to choose pregnancy safe medications for the same. After delivery, then again lactations, then migraine headache triggers because the hormone again there is a fluctuations and there is a
Yeah.
sleep deprivation, psychosocial
Yeah.
factors. Patients will have depression post delivery. So since they have to get up in between at the night to feed the child, so then that's why the different challenge. Sleep deprivation again triggers the headache. Hormonal changes, sleep deprivation, psychosocial factors. There are many things which can trigger the headache again. Those headache which was reduced, migraine headache reduced during lactation during the last trimesters. Again, it
May,
pop-ups
may.
during
And
them.
here, they have to change their lifestyle. Like, for example, hugging the baby, feeding the baby, and breastfeeding can increase the, what to say, oxytocin and the feel good hormones and the happy hormones. And then, sleep in between. Like, baby, you also sleep when the baby is sleeping and then keep awake. So, if you adapt and adjust, that headache also will come down. Yes.
Yeah, that is true. So family support also matters during that time. Trying to understand their mental health. They may have low mood. They tend to have certain features. The behavioral changes during the post
They
delivery.
can go
So
into
family should
depression also. Yeah.
depression. So why the family should support, understand, and give a good care. The family support also matters in controlling the headache, along with the medications what we give. So
Okay.
then again during the menopause, due to the again hormone fluctuations or hormone therapy post menopausal, then also they can have. In transgenders also there is like we see a lot of headache in transgenders also. That is a newer upcoming topic because that
Okay. Oh, that I didn't know. Okay.
yeah, because they have, that they also take some certain
Testosterone's more.
hormones, the test hormones. They can also they also have a fluctuations. They also have an hormone influence in having an acute or chronicity of the migraine. So that is a different challenge for us. So that is also more upcoming and topic of late, which we come across. We see a lot of articles on that. So that also should be considered. In the women post menopausal stage, again hormone fluctuations, hormone therapy, that also, and post after 50
What
years.
about the contraceptives and the tablets to
Correct.
prevent this thing? Will they have any effect on the hormones? And
Definitely, definitely. It's a very good question, madam, because we have seen, that hormones per se, the hormone therapy when they take, that can also contribute to the headache. And more than that, these hormones can have they increase the frequency of CVTs, actually, corticovenous
yes,
thrombosis
yes, yes.
in these patients. And there are certain things like retinoic acids and all, whatever the youngsters use, for pimples, acne treatment. That
Yes.
can also cause an increased intracranial hypertension,
Headache.
IAH we call it
Okay.
as. So
Okay.
that type of headache is different, and they come with blurring of vision. They come with headache with blurring of visions. Then if we see the fundus, we'll see that there's a papilledema and all those things. And then
Oh.
when we do an MRI brain and we get to know that there is an IAH features, that demands a different way of approach when it comes to treatment. So that's why all these stages in a women especially It's a different challenge. Per se, all this contributes to the chronicity of headache in a woman.
Okay. Anything new things that have come in treating the headache in recent time? See, earlier
Definitely.
anybody headache means they would go and take one aspro and then sleep off, or drink something hot and sleep off. But today it is not like that. They have to find out what is the cause. So depending on the cause, is there any new drugs or the new treatment?
There are a lot many new things have come. See, there is a neuromodulations, we call it as neuromodulations, where we use Kefali. It is nothing but based on the pathophysiology. They have devised this. These are the devices which are available. Kefali, which they use it like a crown over the head. So it just keeps vibrating and it reduces the headache.
Oh, that's so nice.
So,
Okay.
and
It will be like
Narivio.
massaging. Okay.
Yeah, that is one. So what that is one neuromodulation therapy what we use, that Kefali we have. We have Narivio. So where they use like a band, arm band. So that also reduces. That is for the neuromodulations. Transcranial magnetic stimulations are there. So this way, and vagal stimulations, the vagal nerve stimulations. There are some devices which uses the vagal, the gamma core devices, which stimulates the vagus nerve stimulations, and that also helps in reducing the headache frequency and controlling the migraine frequency intensities. Apart from this, we have lot of many things like a this riboflavin. But the vitamin which we use it in a higher dose can reduce the frequency intensities. Magnesium can reduce intensity frequencies along with coenzyme Q. And there are monoclonal antibodies, GPANs are there, Ramigipans, Ubrogipans. So all those different GPANs are there, which also are the newer thing which has come up in controlling the migraine.
Okay. Thank you so much, Rupa. In fact, you have told what all armamentarum you have. It is like a war against the headache. So, like how they have the different missiles, you have a different medicine. But ultimately, to simplify, avoid constipation, eat banana, which has a serotonin, which will reduce the headache and also constipation, reduce the screen time, and as much as possible, sleep well. And then if they have any occipital headache, go and get your eyes tested. And if you have any sinusitis, allergy, get it treated. And more than anything, don't worry, be happy and keep smiling like Rupa. And that's how you can keep away from the headache. Thank you very much, Dr. Rupa.
Thank you so much, ma'am, for this privilege. Thank you.
It was wonderful talking to you. Thank you.
Thank you. Thank you. Same here, madam. Thank you.